Hello, classmates. My name is Ashley Aguilar. Did you know a psychological disorder is defined by a psychological dysfunction within an individual that is associated with distress in functioning and a response that is not typically expected? Let's take a patient named John, for example. He's feeling extremely depressed for a while, and due to it recently affecting his attendance at work, has come to therapy. After other questions, John could be diagnosed with major depressive disorder. Today, I want to inform you of historical developments that have helped to define many mental illnesses and have helped to support the mentally ill community today. Without the advancement in psychopathology, patients like John could be misdiagnosed or misunderstood in the cause of his symptoms. We sometimes find ourselves talking down or being frightened of things that we don't understand. After studying the approaches of abnormal behavior, it is easier to see these patients as normal people that simply have more dramatic problems than the rest of us. It wasn't always easy to explain why someone acted abnormal. In early years, supernatural approaches were adopted and stated that irregular behavior was associated with demonic possessions. In the 19th century, a biological approach was adopted that stated physical conditions like disease or a chemical imbalance cause disorders. Today, we use a psychological tradition that states social, cultural, and psychological factors all play a role in developing a psychological disorder. This goes into our multidimensional model that therapists use today. This understands there are many independent influences at many different points in one's life that can affect their future behaviors. So we can't always assume that someone with schizophrenia got it from a chemical imbalance. It can actually come from a sexual traumatic experience. Now, assessing psychological disorders, the assessment needs to be reliable and valid. Reliability measures the consistency of an assessment, making sure it's fair across the board. If one doctor gets one assessment and gets a result, and another doctor would get the same results. If that is right, then it's reliable. Validity measures if a technique diagnoses what it's supposed to. If I want to know if someone has bipolar disorder, the assessment needs to measure bipolar disorder. These allow for the assessments to accurately distinguish between the countless mental disorders we have. Diagnosing a disorder can take some strategies. Collecting an individual's personality, circumstances, and cultural background is known as an idiographic strategy therapists use. Now, attempting to name or classify the problem the patient has, this is known as a nometic strategy, where diagnosing is. But there's so many symptoms and so many disorders, how do we distinguish all of these? We use a prototypical approach, which identifies certain essential characteristics of a patient so they can be classified, but also allows non-essential variations that do not necessarily change the classification, but are still important. Now let's take a look at some common disorders that we kind of overlook. Anxiety disorder. Well, first of all, anxiety is not always a bad thing. It actually can help us. Too much anxiety is when disorders come. Anxiety can provoke symptoms of physical tension and apprehensions of the future. Many disorders are related to an excessive amount of anxiety. Now, personality disorder is a chronic pattern of emotions, cognitions, and behaviors that result in emotional distress for the patient. Let's take someone that has paranoia disorder. Someone with that personality disorder will not be able to have great relationships with others because of their paranoia. There are 10 personality disorders in the Diagnostic and Statistic Manual, and these 10 disorders are put into 3 different clusters. Cluster A represents odd patients, Cluster B are dramatic or emotional patients, and Cluster C are the anxious or fearful patients. All of these clusters are here to categorize different symptoms. Now that I've shared with you important theories and disorders that attempt to explain the causes of abnormal behavior, I hope that you've been educated on the person behind the mental disorders. There is nothing abnormal about being ill, being traumatized, or being different. Thank you for choosing to listen to me today. Have a great rest of your summer break.